Okay, today we're going to have a teach back on the conditions involving the kidney, the urinary tract, of course, at the same time male and female reproductive organs. So as we always say, we always start with a review of the anatomy of organs, right? So can anybody tell me what is the main function of your kidney? Filter what?
Blood.
Filters the blood, remove the waste from the blood, allow the waste to come out where? The urine, right? Okay. So how many kidneys do we have, class? Two kidneys. One on the left and one where? On the right. Okay. So why is the right kidney lower than the left kidney?
The liver sits right above.
Okay, you're absolutely right. So the left kidney is here, the right kidney is there. The right kidney is lower than the left. And as you can see here, the reason why is because of what organ? The liver is here, right? So apparently this organ called liver is on top here, and it will displace the kidney downwards, right? Okay. So as you can also see here, the kidney is within the abdominal cavity, okay? And as you can see, the kidney brings the urine where? To the urinary bladder via what? The ureters. So if you have two kidneys, how many ureters do we have? Two. How many bladders do we have? One. So be sure that's called the urinary bladder. It is not the gallbladder, right? Okay? The gallbladder is found where? Below the liver, okay? Gallbladder, differentiate that from what? The urinary bladder. What does the urinary bladder contain? Urine. Don't you love anatomy, right? The urinary bladder contains the urine because the urine is formed by what organ? Two kidneys, right? Okay. So as you said, the main function of the kidney is to what? Filter blood. Which means you remove what? Waste from where? The blood. And excrete via what? The urine. Can anybody tell me what are these waste products that we are going to excrete? Okay, you have one called urea, creatinine, and uric what? Uric acid. So these are what we call nitrogenous waste. And obviously because they're called nitrogenous waste, what do they contain? Nitrogen. And these waste products are brought about by the breakdown of what particular food substance? Proteins. Very good. Okay. What are the building blocks of proteins? So when these proteins are utilized by the body, our body, you come up with waste products called urea, creatinine, and uric acid. And as such, you need to get rid of them because what do we do with waste products? Keep them or excrete them? Excrete them. Okay? So, and you might be wondering, why do I need to know this thing? It's very simple. When a patient suffers from chronic kidney disease, what kind of diet do we give? High in protein or low in protein?
Low.
Exactly. Do you know the reason why? Yes? Why? Why low in protein? See, it's not just a matter of knowing the answer, but knowing why, where, what organ is involved. Why did you say low protein? You have to justify your answer. A smart student must know the reason why the answer is this and that. Be able to rationalize, analyze. Anybody, why is it going to be a low protein diet? Yes? What's your name again?
Paula.
Paula, yes?
Because these substances won't be secreted and will end up around the body, which can cause...
Okay, again, one more time. Why would you give a low protein diet? Because why?
Because the kidneys can't remove them from the body.
Mm-hmm. Okay. Anybody else wants to try? Okay, at least I know what. Yes?
Is it because with high protein it puts more pressure on the kidneys? It
to what?
does more to filter out?
More to filter out, and how you produce what? More waste or less waste?
Waste.
Of course, so it's just common sense. If you decide to give a high protein diet, then will that also increase the amount of waste products that are called nitrogenous waste from protein breakdown?
Yes.
Yes? In other words, it will take more difficult time to clean the blood or filter the blood or remove the waste of the blood if you give more protein. The analogy I'd like to give here is this. Let's say you have a janitor assigned to this building and these rooms here, right? The janitor is assigned to clean 3 classrooms, right? 3 classrooms every day. 1 week later, the janitor got sick, kidney disease, okay? So would you like this janitor to rest, or would you like to give him 6 more rooms to clean?
Rest.
Of course. In fact, you would actually let him, okay, you know what? Instead of cleaning 3 rooms, just rest today, and then when you come back, you can clean the 3 rooms. I cannot afford to give him what? 6 rooms, 6 more rooms to clean, because why? He is sick. The same thing with the kidney. If the moment you give a high protein diet, as simple as that, I'm trying to simplify things here, the more waste products you produce. What kind of waste products? These 3 will be produced. And remember, the kidney is like the janitor that cleans the blood. It's supposed to remove the waste from the blood. The more waste produced because of more protein diet to high protein diet, the patient will get better or worse?
Worse.
Do you understand what I'm trying to say? In other words, there is nothing in the nursing board exam that you cannot answer if you know pathophysiology. So you are guaranteed to pass, especially if you get an A in this class, right? 99%. Okay? Now, so you said the kidney filters the blood, correct? So what is the blood supply? What is the name of that blood vessel that brings oxygenated blood to the kidney? Renal what? Because what does renal mean? OMG. Again, don't you love anatomy, right? And where did the renal kidney artery come from? Okay, which one? Very good. So this is the abdominal aorta, right? And the aorta came from what? The left ventricle of the heart, right? Ascending, arch, descending, pierces the diaphragm. The abdominal aorta gives rise to 2 renal arteries, one to the right and one to it. The left kidney, correct? And it carries what? What are the things being carried by the arterial blood? Oxygen, transported in the red blood cell. At the same time, it carries what? Urea, creatinine, and uric acid plus the oxygen. It is ironic. It brings something it needs. It also brings something that it has to excrete. What does the kidney need? Oxygen, because it is what? Made of tissues, made of organs, and made of cells, correct? Okay. Now, what will bring out the carbon dioxide from the kidney? The veins. So what color would I use? Blue. Okay. So the veins, to make it simpler, the veins bring our carbon dioxide, brings it to what major blood vessel? The 405 freeway or the 5 North freeway. Okay, very good. And inferior vena cava brings the blood where?
To the right atrium.
To the right atrium of the heart. So you have a circle here, right? From the heart to the organ, of the organ back to the heart via the right atrium. In between these 2 would be what? The lung, right? Because the carbon dioxide will go to the lung, and the lung gets rid of carbon dioxide, and the lung brings blood, oxygenated blood via the left atrium, right? That's our topic on the cardiovascular system, correct? Okay. In other words, the blood we have, it has to pass through the kidney for it to be filtered. All the blood we have. Does that make sense? Is that clear? Okay? So, as simple as that, we need to understand that when the kidney is going to be involved, what is the functional unit of the kidney? The nephron. Did you remember this nephron? Right? The nephron, as you can clearly see, okay, let me erase this part here, okay, you have your Bowman's what? Bowman's capsule. What is PCT? Proximal convoluted, tubule convoluted means it's made of tubules, coiled, like this, and then the lobe of, okay, the descending and ascending limb, and then the distal what? DCT, distal convoluted tubule. This is the lobe of Henle, and this is the collecting what? Collecting duct. Okay? In front of the Bowman's capsule is your glomerular what? The glomerulus. What is the glomerulus made of? Capillaries. And what is a capillary made here? What is a capillary? What? The smallest blood vessel in the world. Right? Make this red. Blood. Okay? Made of capillaries. Now, where did the blood come from? Series of arteries. But eventually it came from where? The renal artery, which carries what? Oxygen plus, of course, what? The waste. Urea, creatinine, and uric acid. I just put the first letters. And the artery came from where? Aorta. And where did the aorta come from? The left ventricle of the heart, which is oxygenated blood from the lung, correct? From the left atrium, from the lung. Okay? Now, so when the blood enters the glomerular capillaries, now let's complete this first. You have what? You have the afferent arterial here. And what comes after the glomerulus? Efferent what? Arterial. Followed by what is peritubular what? Capillaries. So you will notice here you have two sets of what? Capillaries. One is called the glomerular capillaries. The other one is what? Peritubular capillaries. Followed by a series of veins. And you have renal what? Vein. And then of course into the vena cava and then what? The right atrium of the heart. In other words, the blood circulates all throughout the body. From the heart, kidney, back to the heart. Circulate. As it passes to the kidney, what will the kidney do? Filter the blood, remove the waste. Okay? For those of you who were once upon a time a student of mine in anatomy, what did I compare the glomerular capillaries to? To act as a filter. What did you say? Why am I smiling at you? Why am I smiling at you, my dear? Because you're right or you're wrong? You're absolutely. What's your name?
Betsy.
Betsy? Betsy, you're absolutely right, Betsy. Okay. As trainer, if you go to the kitchen, your mom is a trainer. What does a trainer have? Huh? 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 What kind of hose? Big or small?
Small.
Small or small? Small hose. Imagine all the people having a empty glass. I put a strainer. I put an orange fruit. Can you smell the orange fruit? It smells so good. Can you see the orange fruit? What is the color of this orange fruit? Orange. What else would it be? I put the orange fruit here. I squeeze the orange fruit. What comes into the empty glass? The orange juice. That's the urine. What stayed on top? The pulp. Why is it that the pulp and the seed did not go through? Because the pulp and the seed is what? Big or big?
Big.
And those are?
Small.
That represents your red blood cell. That represents your proteins in the form of albumin and globulin. Your plasma proteins were in the blood plasma. Do you understand? Okay? You understand, right? Okay. So what came out here was what? The urine containing what? The urea, the creatinine, and uric acid. So what I will do now, can I convert this into a capillary? That's like a tube that allows the blood to pass. Okay, but it's a very small tube because it's a capillary. Only one red blood cell could actually pass through, right? If you remember the anatomy of the afferent, glomerulus, and efferent, the afferent's diameter is what? Bigger. Glomerulus here with the holes or pores, and the efferent is what? Smaller in diameter. What happens to the blood pressure inside when you vasoconstrict? The blood pressure goes up. So remember what did I do with the orange fruit? Squeeze. What did I do? Squeeze. So what happens now? Because of the elevation of the blood pressure as a result of the smaller diameter of the efferent arteriole compared to the afferent, the glomerular capillaries are here. What will the elevated blood pressure do to the blood? Squeeze. Push the blood against what? The wall. When it pushes the blood against the wall, what comes out here will be what? Urea, creatinine, and together with the other components of the filtrate called the initial form of urine, which is mostly also water, correct? Water, urea, creatinine, uric acid is coming out here. What happens to the red blood cell? Goes back to the blood, it stays in the blood, passes here, remains in the blood. Because why? Is the red blood cell a waste product? No, it is not. And the blood cells are not waste products, right? What about the albumin and the protein or globulins within the blood? Are they waste products? No, they're not. They should remain here. Correct? Is that everything is clear? Now, what happens when you have glomerulonephritis?
The whole is
Inflammation of the glomerulus? What happens to the holes? Will you have hematuria? Will you also have proteinuria? So where will the proteins go? In the urine. What happens to the blood protein? Decrease of hypoalbuminemia, right? And what about the red blood cell? Goes there too, right? Do you understand? Okay. So one of the most common example of glomerulonephritis is what they call post-streptococcal glomerulonephritis. The streptococcal bacteria initially a week before will attack first what? The sore throat, the throat. Remember, it's called tonsillopharyngitis. A week later, you complain to your doctor. A week ago, Dr. Gamo, I had a sore throat. I had tonsillitis. 1 week later, which is today, I have developed red urine. What is red urine? Hema means what? What is found in the urine? And what is hematuria therefore? Don't you love anatomy and terminology? What is therefore the normal color of the urine? Okay. Pale yellow to amber. Okay. The point is, when it turns red, there must be what? Blood, which is seen in glomerulonephritis, right? Okay. In other words, you have proteinuria, hematuria. Okay? Do you understand, class? Okay? In the case of post-streptococcal glomerulonephritis, what is the main mechanism of pathology or pathogenesis? Huh? It's an immune complex disease, whereby when you had a strep infection, the antigen was a streptococcus bacteria, the body developed what? Antibodies, immunoglobulins against the antigen, forming an antigen-antibody immune complex which destroyed what? Glomerulus. In other words, there is nothing that you cannot answer in this world. All you need to do is understand what you read and retain what? Information, and be able to what? Apply. And you will get an A in this. Is that what you want?
Yes.
Of course. 93% is an A. Is that clear? And if you get an A, will you be assured of passing the nursing board exam to be able to pay your student loans of 150,000? Yes? Okay, now, is that clear so far? Okay, so we're just going into some of the examples there, and we'll move on to this. Okay. So we talked about the fact that as a nurse, are you going to monitor the urinary output of your patients?
Yes.
Are you going to monitor the vital signs?
Yes.
Of course, blood pressure, heart rate, all those respiration rate, right? What is considered normal urine output? Anyone? 30 what? Okay, per what? Okay, anything below 30 ml per hour is considered what? Less than 30 ml. And what does oligo mean? Scanty. Scanty or less than normal. Oliguria. Okay, do you understand? So if your urine output is, let's say from 6 p.m. to 7 p.m. is only 20 ml, between 6 p.m. to 7 p.m. that's 1 hour of 20 ml. Is that normal or abnormal? Is this patient suffering from oliguria?
Yes.
Is the patient oliguric?
Yes.
Would you call Dr. Gamo? Okay, Lucine, pretend that you're the nurse. Okay, tell me. Go ahead, Lucine. Our patient is Mr. Smith. Tell me the results of your urinary output finding. Go ahead. Based on what I just told you 5 seconds ago.
Okay.
Okay, cling, cling, cling. Hello? Okay, go ahead.
Hi, this is Lucy.
Lucy.
Follow-up nurse for this patient.
Okay.
I want to report my patient's urine output.
What is the urine output, Lucy?
It's less than 30 cc.
And what is the exact amount? I want to know the exact amount, Lucy.
20.
20 ml. See, you have to have, you can't be, you can, okay, this is what happens. When the doctor asks you a question, all the data should be in front of you, the lab chart results. Because what happens if they call and then you call him, and it's 3 in the morning, Lucine.
I left a message.
I am so tired, and here you are calling me and you don't have the figure. Say, okay, you call, okay, I ask you, Lucine, what is the exact amount of the urine output? You say what?
20.
20 ml. Okay, and I said, okay, Lucine, so what is our patient suffering from whatever disease he has, right? Okay, so with that presentation, decreased urinary output of less than 20 ml, could this be an indication of acute renal failure? It could be, right? Because normal function should have made him have a urine output of how much? More than 30 ml. Okay, some book would say 400 ml per day, but we look at the hourly rate because these are patients in the intensive care unit, right? And many of them would have an indwelling catheter with a Euro bag. You understand? Now, as a result of this, we would say, then we would probably ask, does the patient have fever, blah, 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 right? Does the patient have any change in the color of the urine?
Yes.
Okay, because hematuria or whatever, okay?
Or painful.
So now, my question is this. What diagnostic test would be used as a form of a diagnostic tool for kidney function test? What diagnostic tools do we use? Yes? BUN and creatinine. Very good. It's called BUN and what? Diagnostic kidney function test, right? Your BUN and your creatinine, right? Okay. So what I would say, hey, you know what, nurse? I want a stat BUN and creatinine done, right? Okay. Now I would ask the nurse, what specimen are you going to send for the BUN? Blood?
Urine.
Urine. Who says blood? Okay, who says urine? Okay, let's find out. So, how many of you did not raise your hand? I think 90%, okay? So, if this were a board exam, you say, oh, what will I see? Okay. Okay. What does the B stand for?
Blood.
So, what specimen?
Blood.
Okay. Is it blood or urine? Is it blood or blood? Is it blood or blood? Okay, how many times would it be possible for a nurse to give the urine specimen?
3.
I'm not trying to put down the nursing profession because I might be having enemies with my nursing colleagues here. It's called common, based on prior knowledge, that the B stands for what?
Blood.
Give me a B.
That's it.
And what does the U stand for?
Urine.
And what does the N stand for? Oh my gosh! Amazing! Blood, urea, nitrogen. Blood, what is the urea? I erase the word urea and I will erase the word nitrogenous waste. How can you fail the nursing board exam with such wisdom and knowledge that you have? So never will you give the urine specimen when you are told to get a urine specimen to be sent to the lab. Because if you do so, what will the people from the lab would say? What kind of nurse do we have here? They come from a different school. If this were a West Coast University graduate, he will always send what specimen? Blood. What about serum creatinine? What specimen are you going to send?
Blood.
Of course. Now the next question is this. What is the normal BUN value? 8 to 25 what? Milligrams. Let's talk about your creatinine. 0. What? 6 to 1.5, right?
Yeah.
Correct? The bottom line therefore is this. If the BUN level is above 25, remember Christmas Day, 25. Is that elevated?
Yes.
Why will it be elevated? Because if the kidney is failing, will the kidney be able to filter the urine?
No.
Will the urea be able to go here in the urine and out in the wee-wee? The urea will remain where? will remain where? And when the urea remains in the blood, what happens to the blood levels of urea when you do a BUN test as ordered by Dr. Gamo? High or high? High or very high? What about the creatinine levels? Will it be above 1.5?
Yes.
Above or less?
Above.
Above or above?
Above.
Why will it be above? For the simple reason that the kidney is failing. When the kidney is failing, you are not able to allow the creatinine going to the urine. The creatinine remains in the... And that's the reason why the blood levels will go up or will go up. How can you fail the nursing board exam? In other words, it is not just knowing the right answer, but being able to what? Explain, justify, rationalize. Because that is how you become a smart student and a smart nurse. Remember? Keep it simple, smart student of West Coast. KISS, keep it simple, smart student. So not only should you know what specimen to send, but at the same time the normal values, because in your board exam, will they tell you the normal values? No. No, they won't. Now what other kidney function tests can you think of? What about the 24-hour urine collection? Huh? So what specimen are we going to collect? We said 24-hour urine collection? Oh my gosh! Isn't that amazing? When I tell the nurse, I want a 24-hour urine collection, correct? Correct? I want to check for the creatinine clearance. What does the word clearance mean? To clear means what? To get rid of the waste? Like to clear the airways of the mucus? Or to clear the waste in the blood? So what is the purpose here? We want to have two specimens here. One specimen from where? From the blood, and one specimen from where? You see what I mean? Okay. Let's say Dr. Gamo. I am Dr. Gamo. I tell the nurse, hey, you know what, nurse? I want you to start collecting at 7 a.m. of Monday up to Tuesday, 7 a.m. 24-hour collection. Okay? That means the patient has a urobag. Whatever urine collected within that time frame, you collect. Put it in one container. Now, the question is this. At 7 a.m., we also do a serum what? Creatinine blood examination. You get the results. And then at Tuesday at 7 a.m., we also get a what? Another what? Serum creatinine results. And you get the creatinine levels in the blood from 7 a.m. to 7 p.m. Now, this is going to come out in the nursing board exam. I want you to pay attention. When you went there on Monday at 7 a.m., you were there in front of the patient, and you found out that the urobag has 30 ml of urine. What will you do with the specimen? Keep that as part of the 24-hour collection or discard?
Discard.
Why would you discard?
Because it's from the previous, before the 7 a.m. So you want to
Very good. It was produced before the 24-hour. You were told to collect starting 24 hours at 7 a.m. of Monday. So if you go there at 7 a.m. in Monday, and there is already 30 ml of urine that is not part of what I told you to collect, what do you do?
Discard.
What do you do?
Discard.
Very good. Start collecting at this time, and then by Tuesday at 7 a.m., you went there at 7 a.m. of Tuesday, what will you do with the 50 ml that is found there? Collect or discard? Of course, collect, because obviously it was produced before the 7 a.m. of Tuesday. Will these things come out in the nursing board exam? Yeah! Because what is the goal? To have smart, competent, critical thinking nurses. Why am I shouting? I don't know why. Okay? The bottom line is this. And there is a formula for computation of the creatinine clearance. We also use what? The GFR, the glomerular filtration rate. Basically, in simple terms, we're trying to find out how effective is the filtration performed with the glomerulus together with the Bowman's capsule. Right? Right? Okay? Does that make sense to you guys? Now, remember these. Let's review the types of urea. When I say anuria, what does it mean?
No urine.
No urine output. Now, one thing you have to do before you wake me up at 3 in the morning and say, Dr. Gamo, the patient is anuric. you better check what? The catheter, because there are times when the catheter, you know what the word kink means? And there is nothing in the urobag because the catheter is kink and the bladder is because there is something wrong with the catheter placement. You know what the word kink means, right? Like, you know. Do you understand? Okay. Anuria, means without urea, without urine output. Oliguria, less than 30 ml. What is polyuria? Excessive amount of urinary output as seen in what? Addison's disease, diabetes mellitus, and diabetes insipidus. Do you understand? Okay? Is that clear, class? Now, so when you're dealing with patients with these conditions, think of what is normal, what's abnormal. Is hematuria normal? No. Abnormal. Oliguria, abnormal. Anuria, even worse. Right? Does that make sense? Okay? Okay? Is that clear to you guys? Now, when it comes to I already talked about post-streptococcal glomerulonephritis as one condition. Another one, what about in nephrotic syndrome? What's wrong with the glomerulus? The glomerulus is abnormally what? Filtering what? What comes out mostly in the urine in nephrotic syndrome?
Protein.
Mostly proteins in high levels of protein, right? That's why in nephrotic syndrome, it's mostly protein. Same thing with glomerulonephritis, but mostly in nephrotic syndrome. And as a result, they develop what? Edema. Remember? Because when the protein is brought out, the amount of protein in the blood becomes less ability to what? Reabsorb the water and bring it back to the blood, the body. Okay? Is that clear? Now, okay, so what is the difference? When you say pyelonephritis, it simply means what? Infection. Bacterial infection of what? The kidney, right? And very often it's due to what? What's the most common organism causing this kind of infection? Escherichia coli, right? E. coli, okay? And oftentimes, can it be due to an ascending infection, like upper infection, urinary tract infection going up? Yes. Or when you have, you know what the word reflux means? Blood going, up, the urine going up, and there's a block, like when you have prostatic hypertrophy, right? And we'll talk about that later on. Or when you have a stone, right? Okay. Now, in the discussion on acute tubular necrosis, there were 3 stages or phases. What were they? Number 1 was what? Prodromal phase. Okay. What's the second one? Oliguric phase. So when you have the oliguric phase, less urine coming out, you develop what? Edema because you are retaining what? Water, so therefore you have fluid volume overload. What's the third one? In acute tubular necrosis? Post-oliguric phase. So what happens in the post-oliguric phase? But the kidney is trying to repair. What happens to the B and creatinine levels? It starts to normalize and goes back to normal, right? In the oliguric phase, it goes up, right? Okay. So always remember that you can either have acute renal failure or chronic kidney disease. So when you're dealing with chronic kidney disease, it really takes months and years. It's usually due to diabetes mellitus. What about recurrent kidney stones, right? Okay. So talking about kidney stones, what is the most common type of kidney stone that we can talk of? Calcium oxalate. 4 years ago, I had kidney stones. And what did they see? Calcium. How did that stone come out? Came out where? From my urethra. I had a baby boy. Like a mother, when the mother is pregnant and the baby comes with the birth canal, remember? Push, push, push. I experienced this. Makes me cry every time I remember that time of my life. The kidney, I had no uterus, but I had a ureter. And the ureter went to the bladder, and the stone lay there for a few days. And finally it came out. I cannot forget that fateful day. I was alone in my labor room, which is my bathroom. My wife was not held, my hand was not held, my wife was not there to hold my hand. I had to endure this. I had no epidural anesthesia like you mothers. So the baby stone came out, and the stone was like this, came out it. Oh shit, Dad. And then when the stone came out, my baby stone died. I could see in his face, he was there for a long time. Dad, my name is calcium oxalate, don't forget my name. So from now on, his name is calcium oxalate gamma. Bless his soul, calcium oxalate gamma. And again, I cannot forget because this started to become problematic a month before that. I had severe kidney pain here. What's the name of that pain when you have kidney pain? It's called what? Nephralgia. What is nephralgia? Kidney pain, right? Nephralgia. And then where is the kidney found? It is retroperitoneal, right? It's lumbar pain, flank pain. So whenever a patient comes to the emergency room with flank pain or lumbar pain, aside from lumbar strain, where stretching of the muscles have occurred, we always think of the possibility of a kidney stone. It's also known as nephrolithiasis. What does lithiasis mean? Stone. What does nephro mean? Kidney stone. You understand, right? Nephro, kidney, lithiasis means stone, kidney stone, right? Anybody here have experienced kidney stones? No, because you're all young. Now, when I had my kidney stone, I was actually on the freeway. And I called my wife. I said, honey, I have severe pain in my left flank. Can you pick me up? I've gone out of the ramp. And this was in Lakewood near the 105 freeway, and our house is in Anaheim. So I told her, pick me up, please. I can't bear it so much. I already had scoliosis because of severe pain. And my wife said, no, just take the side street. Okay, dear. So I was driving home on the side street. I was going like this. I got out of the car. Upon reaching the house in Anaheim, my wife opened the door and saw me like this, and she goes, was it really that painful? And I said, what do you think? I would have not called you if it was not painful. I would have called 911, but I wanted to save money. It's covered by, but I think you still have to pay for the insurance, right? I called my wife to pick me up, but she said, no, just take the freeway out the side street, Imperial Highway, and go to beach. I know that. I've been there many times. So the good thing, she brought me to the hospital. They did a scan. And lo and behold, the reason why it's painful because the stone in my kidney descended here into the ureter, stretching my ureter. And that was the start of my labor pains. And they gave me some pain medication. The stone remained there. The following day, I went to see a urologist because of he knew that I had a medical background, a doctor. He goes, oh, Dr. Gama, what do you want? I can either perform surgery. I said, what about lithotripsy? Lithotripsy is a machine made of ultrasonic wave that will crush the stone to become sand. And then the sandy material will now be able to what? Pass out in the urine. It's a really sandy stone. And he goes, well, it depends on the diameter or size of the stone. So either he was thinking of doing a transurethral, pull it out, and oh my God, my virgin urethra. And I said, okay, okay. What is the other option, doctor? And he goes, Dr. Gama, the other option is natural birth delivery of your baby's stomach. I'm just adding the joke, okay? Of course, he said, we can let it pass by drinking a lot of water. Now, normally I don't drink water, but what do I drink? Coke. So I don't drink water. So would that be a contributing factor? If you're dehydrated and you don't drink water, will it cause the stone to solidify? So when you're dehydrated, you need a lot of fluids. So what happened that time, I think I was drinking 20 glasses of water a day. And then 1 week later, my expected date of confinement, when you're pregnant, remember the doctor would say EDC. What does EDC mean? Expected date of confinement based on the calculation we have, 9 months. Mine was just 1 week. And remember I told you what happened to me. I was there by myself, the stone came out. Oh my God, I could see the baby crowning like this. Daddy, let me go out, Daddy, Daddy. And finally he died. On the way to the toilet bowl. I think he suffered a skull fracture. I tried to resuscitate my baby stone. I removed the calcium silicate. Beep, boop, boop. Despite my heroic measures, the baby died at 7 a.m. May he rest in peace. So I did a post-mortem autopsy done at Kaiser, and they said, your baby stone was calcium oxalate. Now because he's dead, it's going to be called deceased stone. Calcium oxalate gamma, may he rest in stone. So did I learn from that experience? Did I start drinking water? No. The hardest type of patients are doctors. Do I follow my instructions to my patients? No. Do I still drink Coke? Of course. Bad for me? Good for Coke. You get all my dollars, right? Okay. And guess what happened? I don't think my wife will mind. A few months later, guess what? Back pain. My wife, in other words, karma. Don't tell me I'll be in trouble now. So apparently, he was working, she was working, she was at Sinai, and she called me 2 in the morning. Emergency, emergency. What happened? She had stone. I said pain, pain. And I said, where's the pain? So I think initially I thought it was appendicitis. And then she goes to the back. To cut the story short, it was what? Kidney stones. So I flew, I prepared I had a helicopter. That is cooking. I rode from my Anaheim house to Sinai, maybe 45, there was no traffic. So he was in the ER, so I was looking at her, I wanted to smile. See? But she was, okay, so I just pretended not to smile. How are you, my dear? Okay. I kiss her on the forehead and then, smell bad, you didn't take a bath. So I told her, see how painful it was, right? So what's the moral lesson? You drink what? Drink what? How many of you drink water 10 glasses every day? Okay, you don't. Okay, good for you. Don't worry, you will have kidney stones 10 years from now when you're 50 years old. Okay? Okay, now, why is kidney stone problematic? Okay, remember this. In pre-renal injury and failure, remember it's called pre-renal, intra-renal, and then what? Post-renal, okay? What exactly do you mean by pre-renal? Pre-renal kidney injuries causing damage to the kidney. It means the problem is where? Before the kidney, which means what? The blood volume. Do you understand? Pre-renal means anything that leads to hypovolemic shock or hypovolemia, such as what? Diarrhea, such as what? Polyuria. Anything that causes you to have burns, that causes what? Dehydration. Okay? Addison's disease, Cushing disease. And last but not the least is when there is a blood clot here called renal artery thrombosis. Will the blood be able to flow? If the blood is not able to flow, or when there is hypovolemia, will there be enough blood for the nephrons? No, the nephrons will fail. The kidney will fail. That's why you have oliguria. Now, what is the difference between that and intrarenal? What is intrarenal? It's the kidney itself, like in glomerulonephritis, right? You understand? Or when there is what? A nephrotoxic drug. When I was in medical school, a long time ago in the 80s, and one of the common drugs that can cause this would be aminoglycoside. You're what? Gentamicin, garamicin, okay? So these drugs are known to be nephrotoxic, but they're good for gram-negative bacterial infection. So if there is a need to give them, we can, and we think that there's a renal problem, we think of other drugs to give, right? So anything is called intrarenal because it is already a damage to the kidney parenchyma itself. Now what is post-renal? What's the most common? Stones. Post means after the kidney. Post-renal, pre-renal, intrarenal. Okay? So when there is what? The stone here, if there is complete obstruction, what happens to the urine? It cannot flow, what happens to the urine? And the water goes back here, water makes the kidney what? It's called hydro what? And what does hydro mean? So the water cannot go out in the urine, it goes back because there's a stone that blocks the flow of urine in the ureter, then the kidney develop hydronephrosis, which can be seen by ultrasound of the kidneys in the ureter, okay? Is that clear, class? Okay? So all you need to do is simply what? Remove the stone. What is blocking the flow of the urine? Do you understand? Okay, is that clear? Okay? So be aware of these things. Now, when the patient's problem will persist and keeps on coming back, if you have recurrent kidney stones, can that eventually lead to chronic kidney disease or uremia or end-stage renal disease? Yes, it can. Right? Another common causes of end-stage renal disease is what? Diabetes mellitus. Remember, diabetes can result in diabetic neuropathy, nerve numbness in the legs. What else? Diabetic retinopathy, you can become blind with diabetes, and diabetic what? Nephropathy. Okay? What is the common denominator to all this? Angiopathy. Angio means artery. Pathy means what? It promotes atherosclerosis. What happens to the blood flow? Fat deposit in the arteries to the eye, retina, retinopathy. Artery deposits in the renal artery, retinopathy. The same thing with the nerves. The blood vessels to the nerves. Vasa nervorum will also be affected. You end up with what? Lack of blood flow to the nerves. That's why you have neuropathy, you have numbness. They can easily develop a wound you don't even know. And the same thing, the blood supply to the feet is not properly provided. It's compromised. Okay? Do you understand? Okay? So the idea, therefore, is that you have to know what is causing the failure. Is it pre-renal, post-renal, interrenal, or post-renal? Then it becomes recurrent, like kidney stones, diabetes. It may end up with end-stage renal disease. Now, in your book, there is different stages. If the amount of nephron loss is less than 75%, what is that called? Decrease what? Renal reserve, right? In the textbook. What about if it's damage of the nephron between 70 to 90%? Renal what? Insufficiency, right? In your PowerPoint slides. What about if it's more than 90%? End-stage renal disease. And so these are the people who will require what? Regular dialysis and possible kidney transplant. Now, what is a dialysis? It's simply a what? An artificial kidney. So your blood goes to the dialysis machine. It will clean, remove the urea, the creatinine, uric acid, and then what? Bring it back. It's already clean. Now, observe, not all of the urea is removed because you still have 8 to 25 urea remaining in the blood. Not all the creatinine is removed because there is still 0.6 to 1.5. But anything above the normal values is now considered what? Abnormal. Pathologic. Is that clear? Is that clear, class? Okay. So, when we're dealing with these conditions, let me just go over the study guide here. So we have pre-renal, interrenal, post-renal, ATN, the different phases, chronic kidney disease. And of course, we talked about the different types of stones, right? So if it's commonly calcium oxalate, what about the stones in gout patients? Because uric acid is depositing in the joints, can it also deposit in your kidneys? What about if you have an infection of the kidney? Struvite stones, right? Struvite stones if you have kidney infections, right? Okay. And of course, we talk terminology, polyuria, hematuria, glucosuria. What is pyuria, by the way? Pus in the urine. When you look at the urine, it's pale yellow to amber. It should also be clear. The moment it becomes cloudy, most likely there is what? Infection. Pus actually is a combination of dead white blood cell and what? Bacteria, right? Okay, so uric acid, calcium oxalate, struvite stones. We talked about the nephron, correct? And then of course, pyelonephritis is nothing else but infection. Okay, like reflux, when you got prostatic hypertrophy, the urine keeps going back. Okay. Okay, and then of course, cystitis, bladder infection, urethritis. When do you normally get urethritis? STD, right? Through bladder, sexually transmitted diseases. And how do you know when there is STD among men? There is what? Penile what? Discharge and painful what? Urination is called dysuria. So what's the moral lesson that you always bring with you what? A what? A condom. Safe sex, right? How many of you practice safe sex? Of course, we all do. We should do, right? Okay? That's the reason why I always bring what? I'm just joking. My wife will kill me, okay? One time I had a condom in a wallet and my wife said, what is that for? I said, for demonstration purposes. I want to teach my students how to use a condom. Okay. Now, reproductive organs. Let's talk about men first because the men are simple organs. What is a male gonad? What's a male gonad? Okay, gonad means sex gland, and what is that? The testis, right? Okay. The testis is found where? Where's the testis found, my dear? Scrotal sac, right? Okay. When you look at the scrotal sac or the scrotum, you will notice it flat or is wrinkly. Like, look at my face. My face is wrinkly. Why would it be wrinkly? Does anybody know the anatomical consideration? What is it? Why is it wrinkly? The presence of a muscle called what? Dartos. D-A-R-T-O-S. T-O-S, dartos muscle. So for those of you who have not seen a wrinkly scrotal sac, look at my face. Okay. And for those who have seen it, you know what I'm talking about, right? Okay. So everybody smiling. I presume all of you have seen a scrotal sac. Okay. If you don't want to believe me, okay, ask your boyfriend, honey. I just want to be sure. Is Dr. Gamo telling her a lie or? You don't have to show me the evidence, Exhibit A in court, okay? Dr. Gamo, you were right. I saw this from my husband or boyfriend. It's wrinkly, okay? Joke only, okay? Now, there is another muscle called cremasteric muscle, okay? Do you know that the testis once upon a time was what? An abdominal pelvic organ here. I believe, if I'm not mistaken, with embryology and the development of the fetus, the testes will start to descend on the 7th week of pregnancy. Why? Because it is very hot. Is the sperm very sensitive to temperature changes?
Yes.
What happens if the sperm remains and the testis remains there? It's going to be boiled egg. It will, all the sperm will?
Die.
All the sperm will die. Because they will be burned. And what is the condition called when there's failure of the testes to descend? Okay. Are you for a word? Orchid. Cryptorchidism, right? Orchidism. Now, why is it dangerous to have a patient with cryptorchidism? One is that it can lead to what? Testicular carcinoma. Secondarily is they become what? Sterile because all the sperms are dead. So what do I tell the mother, the future mothers in this room? Remember when you are in labor, you're perspiring and you keep on shouting, no more babies, it's so painful. And when you give them an epidural, bang! Okay, fine, babies will be fine.
No pain.
No more pain, see? And then when the baby comes out, okay, let's pretend the baby is a boy. So this is what I strongly recommend, a recommendation of Dr. Gamo. You are just perspiring and the baby is just there in the nursery. The first thing you do is when you see the baby, coochie, 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 grab the balls. Why do you want to grab and palpate the balls? Because you want to be sure that the testis has landed into the scrotal sac. It's true, you're laughing. You cannot presume just because it's bulging there, it could be filled with fluid. And then 10 years later, when the boy is 10 years old and you palpate the tail, oh shit, one is missing, oh shit, sorry. Apologize to this YouTube video. You found out that there is a missing testis there. Or one is missing, one is present, one is absent. You are gonna be you will not have any grandchildren. Your son will become sterile. And worse, your son will die ahead of you because he will develop testicular cancer. So I was not really joking. You must always examine and what? Palpate or palpate? Palpate means grabbing the balls, okay? I'm just joking. Be gentle to your baby. Coochie, coochie, coochie. I'm doing this in honor of Dr. Gamo. OMG. It's solid. Why is it solid? Obviously the testis is there. Oh my God, I'm going to be a grandma. Can you imagine when you palpate? Oh my God, it's all water. OMG. And you call me, Dr. Gamo, my grandchild or my child has cryptorchidism. I need to consult a urologist ASAP. Do you recommend one? Okay, of course, with discounted rates. Right? I'm just joking. Because they have to do something. You cannot let that remain there, and sterility is not going to kill you. What will kill the patient or will be what? Testicular cancer? Do you understand? Do you understand, right? Okay. Now, what are the other problems among men? Very simple. Okay, so as you can see here, so this is the scrotal sac. Okay, the scrotum. The testis is here. Okay. Spermatic cord. Okay. And you can see here that this is what? The urinary what? Bladder. Right? This is the what? What gland is this?
Prostate.
Prostate gland. Can the prostate gland become enlarged?
Yes.
It's called benign prostatic hypertrophy. Can it compress the urethra?
Yes.
The prostatic urethra? Will that affect the flow of urine?
Yes.
Will they develop urinary retention in the bladder because the prostate is blocking the flow of urine? Yes. In what is the diagnostic test for prostate enlargement and cancer? You do a what? Digital rectal exam. So what do? You're going to finger the patient. I'm just joking. Use the digit. It was another word for finger, right? So when you insert the, look what happens. If I insert digital rectal exam, is insertion of the digit into the rectum, because what is in front of the rectum? The prostate gland. Right? You understand? The prostate is there. That's the reason why we do this. With, of course, gloves and KY jelly. And the doctor can tell whether it's enlarged or not, or whether it's painful or not. Okay? Is that clear? Okay? So that's one. You have all the other glands here, remember? The seminal vesicle, what is found in the seminal vesicle produces semen. Prostate also contributes to the formation of the semen. What about the Cowper's gland or bulbourethral gland? Also contributes to the semen. The semen that is produced is important for the sperm. Why? Because the semen is alkaline or alkaline? Why is it important? The vagina is what? Okay, the baby is down. Okay. The vagina is what? Acidic. During penile penetration, you know, when the man reaches his point of no return, and what is that? Orgasm or climax, right? The sperm is going to travel here in the birth canal called the vagina. This is very acidic. Do sperm like acidic environment? No. As they are traveling here, this is what the sperm will do. Can the sperm be able to walk or run? No. All they can do is what? Because they only have a tail or flagellum, right? Oh my God, it's so acidic here. We're gonna die. Oh my God, okay. But thank God we have what? The alkaline what? Semen to protect us. Thank you, prostate gland. Thank you, seminal gland or vesicle. Thank you, bulbourethral gland. But at the same time, they are praying the prayer of what? As I walk in the valley of death, I fear no evil, because the semen contains alkaline secretions. Goes to the acidic. Isn't that amazing? What nature will do just to protect the sperm? Whether you like it or not, you are the product of a sperm and an egg. Thank God, Father, for the sperm. Thank God, Mother, for the egg. Right? Okay, going back to the sperm. In other words, the sperm is produced in the testes by the seminiferous tubule, correct? Okay. Now, unfortunately for this specimen, somebody stole the testis, the penile organ. Where is it? Missing in action. Where is it? Oh, there it is. Remember Lorena Bobbitt? So this specimen was bobbitized. Gone. Okay. So when the conditions mentioned in the student guide or study guide was, normally the urethral meatus is there, right? What happens if it's on top or dorsally located? Epispadia. What happens if ventrally located? Hypospadia. And what is persistent painful erection? Priapism. Is that going to be very painful? Of course. Okay. Because of the persistent painful erection, it's called priapism. Okay. Is that clear, class? Okay. Priapism. Okay. Now, of course, we talked about in women, very simple. This is the uterus. This must be what? Fallopian tube with the fibra. Uterus, fundus, the body of the uterus is what? Cervix. Main cervix. And this is what? Why are you laughing with the cervix? The vagina or the birth canal down here. Vagina, cervix, like it's actually like a, you know, crispy donut. It's true. I have seen many cervixes in my lifetime as a medical intern in the Philippine General Hospital. Is the fallopian tube like this? The fibra is there. So remember, what is it called when the egg is released once a month? Ovulation. And where does ovulation occur? 14 days after the first day of menstrual period. That's the best time to have sex so that the baby can, the mother can become pregnant. So what's your number?
14.
Mr. Wei, are you applying to, are you married? Single? Andre?
I'm not married.
Okay. You want kids? You hate kids?
No.
Maybe you want kids?
Not now.
Not now, because she's the one to pass the nursing board exam, right? Okay. The gentleman to your back, what's your name?
Francis.
Huh?
Francis.
You want kids? How many wives do you have right now? Why are you laughing? Is there something funny I said? Did I say wives or kids? I'm sorry. How many kids do you have? You're still single? No comment. Okay, I understand that. If you ask me, what about me? Ask me if I'm single.
Are you single?
Of course. What is the definition of the word single? One. How many am I right now? One. Am I single? Yes. Because single is one. But when my wife comes around, I become double. And I love my wife. I love you, honey. You understand? Okay. I'll be in trouble with my wife. Okay. So, ovulation. Egg is released, right? Once a month. Okay. Now, what happens after ovulation? 14 days. How do you know the woman is ovulating? Because there is no more time. I'll answer my own question. You don't mind, right?
No.
So, if you want your woman or girlfriend or whatever you have to get pregnant, a mistress or what, I don't know. You want her to get pregnant. So what you do is this. Honey, when was the first day of your first menstrual bleeding? She would say, okay, honey, it was September 1. So let's say I have never had any menstrual flow, but it's usually what, 4 to 5 days I was told, right? Am I correct? Okay. So September 1 to September 4 or 5. 5 it stops. The problem is that the 4 or 5 could be varying from one person. We always start counting with the first day. September 1, 14 days later is September 15. Within that day period, for example, our class today is September 15. What should you bring with you if you want to really get pregnant? You've been married for 5 years, you bring with you what? A thermometer. So you're going to measure your thermometer, and then when you're listening to my jokes and my lecture here, and it's already 7:05, I'll say, oh my God, Dr. Gamo, there's a rise in my basal body temperature by 1 degree Celsius. I am ovulating. You're exempted. You go. I have reserved a room for you. Hilton. Your husband is waiting. Courtesy of the J. Gamo Foundation. The bottom line is, it's called proper timing. How can you become pregnant when the egg is not there and the sperm is waiting? Where are you, egg? You! Sperm! I'm here, I'm the sperm. There is no egg. Why is there no egg? Because the woman is not ovulating. There's no reason for the woman to get pregnant. Does it make sense to you? I'm an expert on these things. Even though I only have 3 kids. I would have wanted more, but my wife said no more. I said, okay, yes, dear. I wanted made in America, but everybody was made in the Philippines before we migrated here. And I said, can I have another baby with another woman? No, okay. Yes, dear. Who is the commander-in-chief in the house? My wife, okay. Okay, anyway, going back to the only reason why I do these jokes is to make you awake, right? Because can you imagine it's already 7 at night and we all have no jokes, we all be what? Okay, so women. What do women have as a problem? Okay, women. What's wrong with menstruation? Why do women menstruate? Does anybody know why women menstruate?
They shed blood.
Why do they shed blood? So I heard that these women have blood bleeding. I'm just joking. So there's vaginal bleeding, and in fact, it's not just blood coming out, but part of the endometrium. If you remember the walls of the uterus, right? Okay, what are the walls in the uterus? Endometrium followed by? Myo what? So these are the ovaries here. Like ovaries, fimbriae, fallopian tube. This is where the baby was supposed to be, and then what? So you have the endometrium, myo, and then what? Perimetrium, correct? Okay. So when you are having menstrual bleeding, the endometrial wall is going to be sloughed off or comes out. Why? When you ovulate on the 14th day after the first day of menstrual bleeding, what happens to the progesterone levels? They go up because there is a possibility to get pregnant. What will progesterone do to the levels of the thickness of the endometrial wall? Thicker with a lot of blood vessels in preparation for what? Implantation of the fertilized egg. Remember? The sperm fertilizes the egg where? In the fallopian tube. Sperm. Remember the movie Lucas talking? I'm in the first, oh my God! And then finally one of them reaches the egg, bam! The fertilized egg travels to the endometrial wall, implantation occurs. And it's where so when the implantation occurs, do you want to have a thick wall of blood vessels to support the developing fetus? Of course. So as this fetus is developing there, it's because she's pregnant, right? But what happens if you did not get pregnant? What happens to the progesterone level? It starts to drop. Because why? Progesterone is the hormone for the maintenance of pregnancy. But because you did not get pregnant, what is there to maintain? Nothing. So the progesterone level starts to drop, and what happens? The endometrial wall will what? Die and slough off. That's why a woman who's menstruating is not just blood coming out, but part of what? Part of you coming out in the uterine lining. If you don't believe me, okay, go ahead. Examine. Okay. And, oh, Dr. Gama, you are correct. Here are evidence. Okay. Is that called Instagram or what? Okay. Now, if you want to be a scientific mind, okay. Now the question is this: what happens if you have painful menstruation? It's called what? Dysmenorrhea. Is it really that painful?
Yeah.
What about if it's called menorrhagia versus what is menorrhagia? Profuse heavy bleeding during normal menstrual cycle. What about metrorrhagia? Heavy bleeding in between the normal cycles of 28-hour a day uterine cycle, right? Okay. What is amenorrhea? So when some patient comes to me with amenorrhea, what is the first thing I would think or suspect?
Pregnancy.
I cannot forget this episode of my life. As a medical student and intern, we always look at patients in the government hospital where I trained, and oftentimes, one time I had this 18-year-old woman come to me, brought with a mother, because in the Philippines, the parents were there, and the mother said to me, Dr. Gamo, my daughter has a problem. I said, what is it, ma'am? And she goes, she has not had menstrual bleeding for the past 2 months. Of course, I was smiling deep inside. Okay. First thing I asked, is that sure? They asked the girl, do you have any boyfriend? I know what happened, so, you know. When the levels of estrogen and testosterone are high, love is in the air. La 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 la. So we did a pregnancy test. Lo and behold, the woman is pregnant. Okay, now what else? So, have you heard of the condition called endometriosis? Yeah. Okay, what is it? What is basically? I'm just going to simplify things because we have no more time. In endometriosis, remember when you are having menstrual flow, what is coming out will be endometrial tissue, right? Endometrial. So normally it should come out. All of it will come out here, right? In the toilet, I don't know where I don't know what to do with that, but it's coming out. And then you put pads, I think. Yeah, you put pads right there. The menstrual discharge comes out. In endometriosis, unfortunately, the endometrial lining does not only come out here, but what? It comes out back into what? The fallopian tube, and then fallopian tube, and then what? Into the pelvic organs, like this, right? So apparently what happens is that, I get confused with the male and female. So apparently what happens now is that the endometrial tissue comes out into the fallopian tube, and then here, spilled into the what? Into the pelvic cavity. Do you understand? Okay? Is that clear? So it's not in an abnormal location. Just like, you understand? Okay, so it's going to be very painful too. Okay? It's called what? Endometriosis. Now I also mentioned about, so make sure you talk about what? Cervical cancer. What is the diagnostic test to check for cervical cancer? Papa Nicolau smear. I heard it was what? Greek name, right? Papa Nicolau pap smear. Papa Nicolau pap smear. At the same time, we talked about this is due to what? HPV virus, human papilloma virus, right? HPV virus, okay? And what else? We talked about, you can just read on leiomyoma, which is the most common form of what? Cancer of, form of tumor of what? Of the uterine leiomyoma is form of tumor. And then you have your cervical cancer, ovarian cancer. What exactly is the difference of placenta previa and abruptio placenta? In placenta previa, it is what? Abnormal placement and implantation of the what? Placenta. The baby is here, the placenta is down here. It should have been up here, right? Placenta, umbilical cord, and the baby. And there it's down here. And it can also cause vaginal bleeding. Abruptio placenta, on the other hand, can also cause vaginal bleeding, but most likely what? Premature what? Separation of the placenta. Is that good or bad? Bad. Very bad. The baby can die. Abruptio placenta, placenta previa are the things I listed here that are important. and you will be able to encounter them in our patient. What is hyperemesis gravidarum? Excessive vomiting among pregnant women. Okay. What about uterine prolapse?
Sinking of the uterus.
So remember, if you remember the anatomy of the pelvic floor, with the pelvic floor muscles, okay, pubococcygeus, subcoccygeus, and all those muscles there, you're supposed to what? Support the uterus, right? What happens is that because of a lot of times when you have a lot of pregnancies, like if you have, how many of you have planning to have 6 kids among the women in this room? Okay, 6 to 8 kids. What happens? Every time the baby comes out, 6, 8 babies. Will that stretch out the pelvic floor muscles? Right? So it causes the uterus to what? To come out. So this is the vagina, the uterus will come out like this, you know, like a basketball coming out. In fact, in severe form of prolapse, the uterus will come out here. I've seen it in many patients in the government health that I train. Right? It came out, and we had to put it back. Okay, so that's what you call uterine prolapse. And in women like you, how do you prevent that? What kind of exercise do we recommend? Kegels exercise. Do you know how to do it? Who wants to demonstrate? Well, essentially it's Kegels. Although this is not the proper way to do it, but all you can do. Remember when you were hugging, you have a desire to make poo-poo. What do? Oh my God! So you're trying to what? Compress the sphincters around what? To prevent it from coming, you know. So Kegel exercises, okay? So Kegel exercises are designed to help you strengthen your pelvic floor muscles. So make sure you are aware of this. You can give advice to your patients, right? Okay. I think that's all we need to cover today. So I think we have covered everything we're supposed to cover. Okay. Okay. So I'll give you a 5-minute break, and we come back with this. Okay.